Hi everyone, I'm going to show you a quick video on Epic just regarding the DKA protocol. So here I've set up a patient with the DKA protocol ordered and prescribed. So you'll see on the left hand side here, you'll see your specimen collections. This will come up your point of care test, ketones, blood glucose every hour, and you just click on them when they're done. The doctor can also prescribe for a VBG to be collected when needed, so every 2 hours or every hour, whatever they want, basically. So your prescription will come up here on the left. You have your sodium chloride 0.9%, 1 litre due now. You have your insulin infusion, which is due now, and you also have this glucose 10%. Don't take note of this glucose 10%, just ignore it for now, and just concentrate on your sodium chloride and your insulin. So the sodium chloride just goes up normally as you would for your normal IV fluids. I've done another video on that if you want to refer to that. So for now we're just going to do the insulin, and I'm going to show you how your point of care test is viewed easily. So I'll show you that first. So if we go to your chart review, and in this here box here, you'll type in diabetic DKA monitoring results, which will bring you up this graph. In this graph, you'll see your glucose, your recent glucose, ketones, and your recent gases. This will all be done out hourly over the past 24 hours. You can change this to 4 hourly or 8 hourly, whatever, but one hourly is the best way to view this. So that's a good way to view everything together. We'll go back to the narrator and we'll start our infusion of insulin then. So scan your patient just as you would for all your other all your other drugs, and then we'll place a quick line here. Just ignore this. So this will bring up your insulin prescription. You're going to obviously check this with another nurse. Make sure that your prescription is correct. Make sure it says new bag, date and time is correct. Your route is correct. Your dose, which will be prescribed by the doctor. So you'll not need to change that for the moment. And then your flush, and at the bottom here should come up your batch number and your expiry date. It's just not coming up at the moment, but it will come up. And just make sure it's correct and hit accept. And then this will be your dual sign off, so another nurse obviously checking your medication before you give. And that should be it started. So if you go to your flow sheet, your fluid balance flow sheet, you'll see here your insulin infusion has started. You'll also see your IV fluids as well when they're started. So if you want to change your rate of your insulin, depending on your BMs, you're going to come back to this page, which is your ED narrator, and you're going to click on your running infusions. Your insulin will be here. So if we click on that, this will come up again. So you have to change your action to rate change dual sign off. So obviously as we do our DKA on paper, it has to be double signed for your rate change, so it's going to be the same on this. So if you click rate change dual sign off, then you can change your dose, so depending on your BM, and then you're going to override this. And it's going to be 2 mils per hour. Accept. And then it will come up for a dual sign off summary, and that's when your other nurse has signed off that this is all correct, and is happy enough with the prescription. And that's it, signed off. There is a part in this where you can see the guidelines. So if you come back to chart review, you can go to your DKA guidelines and protocol, which is really handy if we forget or we need updated or we need a wee refresher. This is here just for us all to know where it is. Please look over this obviously as you're doing your DKAs and familiarise yourself with the process.